Good morning and welcome to Rockefeller Institute's 2021 Local Government Lab. I hope you enjoyed the first session this morning and welcome you to participate in this forum for New York State researchers, practitioners, and policymakers examining innovation and best practices in local government. My name is Laura Schultz. I'm the Executive Director of Research at the Rockefeller Institute. And I'm going to be your moderator for this panel. This is panel number 3, where we're exploring local government planning and finances. This session will have 3 presentations. Kim Bronner will be exploring, should local governments in New York State use strategic planning? Robert Bifulco and Minchin Lewis are going to be looking at budgetary impacts of other post-employment benefits on local governments. And we'll be concluding with a presentation by Pooya Ghorbani on does New York City assess commercial properties equitably? This is a full day of virtual sessions, so we're asking our speakers today to keep to a strict time limit of 15 minutes. And after they have completed their presentations, we'll have a Q&A session. We ask that audience members please submit questions throughout the panel using the Q&A function found at the bottom of your Zoom taskbar. If you can't see it right now, just hover over the bottom of your screen and it should pop up. And then just go ahead and type your questions. I'll be using those to moderate the session. And before we get started, I'd like to thank everyone, all of our panelists, to take the time to share their research today and their experience as part of today's forum. And we really look forward to your presentations. And with that, I'm going to hand it off to our first presenter. Kim Bronner is a public service professor at the Nelson A. Rockefeller College of Public Affairs and Policy at the University of Albany. Kevin?
Okay, thank you for inviting me here today. And my paper is obviously on strategic planning. So I'll briefly go through it. I have used the work of John Bryson from the University of Minnesota for a long time. I think he provides some great information on how to implement a strategic plan and what we try to do with strategic plans. So basically, he's a major researcher in this area. Now, if we look at some of the books he's written, he has a book from 2018, which really has an interesting chapter in it. And the chapter is Why Strategic Planning is More Important Than Ever. And he's going to go through a series of items here that are important. I'll just go through this briefly. There's new technology developments going on. You can see problems with hacking websites and all that. There's changing population flows, which he says affects demographics, workforces, and politics. Aging and diversified populations affect workplaces, politics, and public finance. There's climate change issues. He talks about inequality in the United States has increased since the 1970s. And he has information on all these topics in the chapter if you read it. Violence, including gun violence, is an issue. And he has nuclear war as a threat. Terrorism threats can affect localities. Economic management's more complex today. Public confidence in public institutions is somewhat lacking, and he cites a Gallup poll in that chapter. And then he also has another item in there. He calls it decline in social capital by the public. So these are things like goodwill, fellowship, sympathy, social interaction. So basically he's saying these are all issues that are important to strategic planning. Now, the current research project really began in late 2019. And just about at that time, there was a nice article in Public Administration Review where they reviewed, I have it cited here, and it says, does strategic planning improve organizational performance? I used this in one of my classes I was teaching at that time. And this article basically says that strategic planning improves organizational performance. And they went through dozens of studies from journal articles and analyzed them to come to this finding. At about the same time, I work a lot with the Office of the New York State Controller documents in my classes. So they have an interesting document here. It's called Standards for Internal Control in New York State Government. And this gets really interesting, because when you think of internal control, often it's in an accounting sense. Do you have purchase orders? Do you have controls to control your money? But the Office of the State Controller says strategic planning is an important part of internal control. And they say the use of goals and objectives using measurable targets are useful to management in state government. Now, I underlined the word state government there because this document is for state government. So New York state agencies have to have strategic plans as part of their internal control. It has nothing to do with local government. So with that, I started off in late 2019 to look at strategic planning for local governments. And the basic research question at that time is strategic planning being used by larger local governments? And I did this for counties, cities, and towns in the Albany, New York area. And this was designed as a pilot study to be examined across the state of New York, meaning I was going to take a look at the counties after this and the cities and the towns. Now, these 12 governments I chose were complex governments. They had revenues of about $2.3 billion if you added them up together. So you would expect to have some sophisticated management here. I just listed the next 3 slides I can go through relatively quickly. I just listed the counties, Albany, Rensselaer, Schenectady, and Saratoga, and I show their revenues. In the cities, there's a city of Albany, there's a city of Saratoga Springs, there's a city of Schenectady, and a city of Troy. And then I wanted to look at this for towns. The town I live in, and I do some of my applied research in, is the town of Colony with a $106 million budget. And I put in 3 other towns that had fairly significant budgets. Now, in order to derive the data to find out if they had strategic planning, New York State has a freedom of information law that you can use, and you can ask questions. So I basically asked them a question: do you have strategic planning? And you can provide any examples of it. And all the responses in this pilot study were received by mid-January 2020, which was nice because it was just before the pandemic hit. So the results of that study, only one of these governments used strategic planning, and that was the Albany County. And then strategic planning was used for only the Albany County Department of Health. And the remaining Albany County departments really don't use strategic planning. So what we found out in the pilot study was that strategic planning really wasn't widely used, at least in the governments in the Albany, New York area. So then the pandemic hit, and it's really not a great time to start a FOIL request and using up people's times when a lot of the governments are closed down. So I really didn't do much on this until the last couple of months. I started to look at some of the larger counties in this across New York State now. And the first thing I did, I looked at their websites. You can do a search on strategic planning. You can get some information. But then if you look at these counties, they're listed there, the ones I'm looking at now. So, they're basically larger counties that aren't in the Albany, New York area that I already studied. So you have some really big counties: Westchester, Suffolk County, Onondaga County, Erie County, Monroe, Nassau. And this isn't done yet because some of the counties haven't answered the FOIL request yet. They've all replied to it, but some have asked for more time. And I'd say most of the counties, I have the answer, but I'm not going to really discuss it in detail because I want to wait till they're all in. But basically, I'm going to find that widespread strategic planning is not used. Now, there's some departments that use strategic planning. Some of the health departments, sometimes for special projects like a housing public authority or some environmental projects, I found strategic planning. So I'm getting a feel that when I finish up with the discussion on these counties, it's going to look like the first group of counties that I studied. And now if we decide, well, what do we do now? I mean, if I'm going to find out that they don't use strategic planning, what do we do? And my idea is I want to promote the idea that larger governments should use strategic planning. And you may not need it for every department, but I think when you contact a relatively significant county in New York State and you ask them about a strategic planning system, I'd like to see someday that they can tell you, yes, we have one. Now, in order to implement strategic plan, I've done this for some New York State agencies over time, but the Office of the State Controller has a really nice guide on developing strategic planning. It's a little dated from 2003, but you can go through that. And as a government official, I used to sit on a town board and help manage all the employees of the town. You could use this document, I believe, to implement strategic planning for local governments. So with that, we can see the Office of the State Controller really thinks that strategic planning is important in New York State. And I believe local governments should have strategic planning. And just a couple more items on this. The Government Finance Officers Association, they have awards for excellence. And their government finance review from late last year talked about, they give awards for strategic planning. So they obviously think this is important. Then just on this, I had a legislative proposal developed, which I just sent into the New York State Legislature. Nothing really formal. I just sent it into my own senator and state legislator and asked them to consider it. When I get the study fully done, I'll send it into the local government committees in the state legislature. But I've started to promote the idea, and it basically says what I have here. If your annual revenues are exceeding $20 million, I mean, that means you're more complex. I think you should have strategic planning. That number could be negotiable, but that's what I'm using for now. Now, just going back to the John Bryson area, one of this was interesting because I've had some applications of strategic planning this year already. Now, in the town of Colony, they have an idea to sell a large drinking water supply. And this was studied at an April 21st public forum of this year. And they had the head of the water department there discussing the concept. And there was a very good person from the audience, who I know is a professional planner. They asked, have you done any analysis of the strengths, weaknesses, opportunities, and threats for this transaction? And they basically said no. So that's a real strategic planning framework right there. So they're discussing this concept, and they're trying to sell the water supply, and they haven't done any strategic planning on it. And then this can get even more interesting because the American Water Works Association says you should have a climate change planning manual, and they don't even have that. So this is just one of John Bryson's ideas about climate change should be worked into strategic planning. And then lastly, there's a police reform going on in New York State, and I've proposed that police departments have a strategic plan. So some of the larger ones do, like the New York State Police Department and the city of New York uses a lot of strategic planning. But if these local governments I listed before don't have strategic planning, chances are their police department doesn't have it either. So you can see real applications here of what John Bryson's talking about. I haven't gotten involved with all of them, but at least on the climate change and some of the social justice items, I am a little bit active. So when my slides come up, if you have questions in the future, I'll be happy to answer them. And that concludes my presentation.
Thank you, Kevin. I invite all of you to submit your questions at the bottom. We'll keep an eye on them and curate them at the end of the session for all of the participants. But feel free to submit them now. For our next presentation, I'd like to introduce Robert Bifulco. He's the Associate Dean, Chair, and Professor for the Public Administration and International Relations Department at Syracuse University's Maxwell School of Citizenship and Public Affairs, and his co-author, Minchin Lewis, an adjunct professor also at Syracuse University's Maxwell School. Robert and Minch.
Okay, great, thank you. Slide up the way I need it. Okay, so I'm going to jump right in. Most state and local governments in the United States offer healthcare coverage for their retirees, and that's kind of part of their employee compensation packages. There's quite a bit of variety across state and local governments in the details of the benefit provided. Typically, full coverage is provided until the retiree reaches eligibility for Medicare at age 65. And then at age 65, coverage either ends or converts to a supplemental plan. The coverage is typically subsidized by the government offering it. And a very important point to note is that unlike pension plans, state and local governments rarely set aside funding for the future costs of retiree healthcare benefits. So there's little or no forward funding. A little bit of historical context. Retiree health insurance became prevalent in both the public and private sectors with the introduction of the Medicare program in 1965, which greatly reduced the cost of providing this benefit. Initially, both private firms and state and local governments accounted for the cost of this benefits on a cash basis. And that means they accounted only for the annual expenditures made for current retirees. In 1989, FASB required private firms to begin accounting for retiree health care benefits on an accrual basis, which means the full expected future cost of promised benefits had to be recorded as a liability in the current year. The resulting accounting statements revealed very large unfunded liabilities, and at least partly in response to that, firms began to phase out this benefit. So from 1988 to 1993, the percent of firms offering this benefit dropped from 66% to 36%. And has been declining since. In 2004, the GASB, the Government Accounting Standards Board, began to require state and local governments to prepare accounting statements on an accrual basis. And in 2015, they issued a policy statement, GASB 75, which required those governments to report the full cost of the liability in their financial statements, the liability for retiree healthcare benefits and other retiree benefits. And again, just as in the case for the private sector years earlier, the resulting accounting statements revealed large unfunded liabilities. To my mind, the best paper on state and local liabilities for retiree health benefits is Lutz and Schneier article from 2014, which uses data from 2011. So a little bit dated, but I still think the information is worth covering briefly. So they found that at that time, total unfunded accrued liability of state and local governments exceeded $1 trillion, which was about 1/3 of state and local government annual revenue. And so that makes, that's about 1/2 the size of unfunded pension liability. In New York, they found $169 billion in liabilities, which was 51% of state and local annual revenue. They also found that states could put these obligations into long-run fiscal balance by contributing an additional 0.75% of total revenue towards the benefit each year. However, there was wide variation in this figure across states, with New York requiring 3% of total revenue, which was the highest rate in the nation. So the questions that we're trying to address or hoping to address in our study are these. What impact does retiree health coverage have on school district budgets, and are these sustainable? How do these budgetary impacts and their sustainability vary across districts? And how should policymakers and financial managers respond? So we'll begin today by examining trends between 2010 and 2017. And the data for this analysis come from annual financial reports, which are sometimes referred to as ST3 files. The data on retiree benefits reported in the ST3 files is a little bit spotty. And so we had to drop several districts with inadequate data, and there were other places where we had to impute missing data. And our resulting sample includes 464 districts in New York State. The ST3 files have several variables related to retiree benefits. In the presentation today, we're going to focus on 3 measures. The first, actuarially accrued liabilities, AAL. These are liabilities accrued to date by current workers. Lots of assumptions go into computing AAL related to turnover rates, mortality rates, how fast healthcare costs are going to increase, discount rates. There's also a couple different methods for computing the liabilities. These assumptions are not made consistently across districts. And they may not even be made consistently within the same district over time. And so one of the things that we're trying to do is to collect actuarial reports from the school districts so that we can compute these liabilities using a common set of assumptions so that we have more comparability across districts and over time. We haven't been able to do that work yet. So we'll just focus on the numbers that are reported by the district. Amortization payments are closely related to AAL, and this is an amount that we computed as the amount required to retire the liability over a 30-year time horizon, assuming a 4% discount rate. And you can think of this as an estimate of the annual payment required to fully forward fund these liabilities. And actual contributions, that's the cash spent on retiree benefits in the current year. So this figure shows the average accrued liabilities for each year from 2010 through 2017. These liabilities grew on average from 58.9 million in 2010 to 82.7 million in 2017. Now, and that's about a 40% increase. Now, whether that's a large liability or not is a little bit hard to say. The figures at the bottom of the slide are meant to give some indication of the magnitude. And they tell us that these liabilities were 136% of total annual revenues in 2017. Another way to get a handle on the size of the liability is to ask, what would it take to pay it off? And so this slide presents the average annual amortization payment that would be required to pay off the liability over a 30-year period. And for the average district in our sample, this was $4.8 million in 2017, which represents 7.9% of all revenues in the average district. On this slide, we compare actual expenditures on current retirees' benefits to the amount required to amortize the liability. And there's two things to note on this graph. The first is that covering current retirees on a pay-as-you-go basis currently requires considerably less than the amount required to amortize the liability. Right? And this fact is why forward funding is so challenging for districts. It's going to cost them a lot more in the current period. And it's also why the cost of amortization increases each year. The second thing to note is that the pay-as-you-go contributions are growing over time, right? And are using up an increasing share of district budgets. So between 2010 and 2017, these outlays grew by about 33%. And that's a faster growth rate than tax revenues are growing in the districts. And so you can see at the bottom here, the percent of total district revenues that are going towards these outlays has been increasing over time. And that's what raises questions about the sustainability of these costs. So this slide says a little bit about the variation across districts, which we think is an important part of the story. And just quickly, the two key takeaways on this slide are that the big city districts, right, which have the highest concentrations of poor and minority students, spend the largest portions of their revenues on retiree health benefits each year. And high-need rural districts have the fastest growing costs. Right? So these costs are hitting the most vulnerable districts the hardest. So with that, I'm going to turn it over to my colleague, Minchin Lewis, who's going to talk about some additional analysis we're doing.
Great. So we are really interested. This is the most interesting part, we think, of the analysis. We want to assess the fiscal sustainability, and we're doing that by examining the budgetary impacts of the retiree health coverage over the next 10 years. And we're using the actuarial reports that have been provided by the districts to do that assessment. So far, we've obtained 13 reports, and 6 of those actually provide the projections of the contributions. So let's take a look at the details of that. So here we're comparing the contributions with the revenue. So we start off with the actual contributions, starting at that $6 million figure and going up through 2017. And then the projections then are from the actuarial reports that show the growth over the period of time. You can see at the bottom, if we compare the contributions to the revenue starts out, the contributions that are required, start out at 4.1% of the revenue, but then they grow over that period of time with just a linear projection of the revenue to 4.9% in 2030. Actually, that 4.9% would be actually more than if they decided 10 years ago to just amortize a total liability. So that's really the case for forward funding these obligations. Now, in the so that would make it look like forward funding is a great idea, but not necessarily the case, because there's so much variation in the districts. So out of the 6 districts that we found, divided them into 4 types of districts based on the percent of free lunch and the percent of white population in the district. So we broke them down into those 4 types. If you look at type 2, you can really see the problem immediately. The contributions per revenue go from 8.5% in 2020 to 11.4% of revenue in 2030. Obviously, a major issue. Also, if you look at type 1, the growth in the actual contribution over the 2020 to 2030 is of 0.6%. That resulted, and we're doing more examination to find out what the details are, from changes in the management of the post-employment benefits. But we want to take a look at that, because what really this variation shows is that we really need to do an extensive, more detailed analysis, and we need to take a look at a much bigger sample, and that's what we're going to be working on. But out of this comes some policy options that we can see already. So one of the policy options is just to continue the status quo. That's a pay-as-you-go basis. As Bob had explained, the actuarial projections are so complex, so much detail involved in them, very difficult to understand. It just makes sense to just pay the bill that you get from the from the claims administrator, put that amount in the budget. That's what actually gets spent. You don't have to go into those actuarial projections and get lost in all of that detail. The other option is to forward fund the amount. That would mean creating a bank account based on the actuarial projections, so that the amount that would be required to fully fund the obligation that incurred in a current year, put that money in a bank account. When that employee retires, 20 years from now or whatever, the money to pay the health retirement benefits is already in a bank account. No budget impact at all. So that's the forward funding thing. Obviously, GASB believes that's a GFOA believe in that, but that's very difficult in terms of from a political point of view, because that raises taxes now, and instead of lowering taxes now and raising taxes in the future. The other option is reducing benefits or changing plans to negotiate a change. That's worked in some cases, and that would make a difference. Targeted state aid in New York State is a possibility, because so much of New York State is really committed to education. There's a possibility that there would be additional money. Also, we just found from the stimulus money that comes from the federal government, unbelievable, possible that there would be additional federal funding for this, or a change in Medicare would make a gigantic change too in the current obligations. So those are policy options that we want to explore going forward with more detailed analysis, and we'd be happy to have input from everybody and questions and comments in the period coming up later. So thank you very much for participating.
Thank you, Robert and Mitch. Very fascinating way to look at some of the expenses facing local school districts. Appreciate it. I would like to encourage everyone participating today to go into the Q&A section and leave any questions for our presenters today. There may be one that they can clarify, or questions that we can use to get the conversation started after our final presentation. And for our final presentation, we have Pooya Ghorbani. He is an economist at the New York City Independent Budget Office. Pooya?
All right, I'm unmuted now, right? Okay, thank you so much for having me. Yeah, so this is hopefully shedding some light on another aspect of local public finance, which is commercial property taxes. This paper that I'm presenting today is an ongoing work that I've been working on at IBO, which is basically an exploration of the way the city assesses the value of commercial buildings. Very quick overview of what I'll be talking about today. I'll start with some of the background, how the topic came about for me, the research questions. Then the first part of the paper is an analysis of some of the outcomes of the current methodology of assessing commercial buildings, which is based on their income. And then in the second part, I'll be discussing the feasibility of using an alternative method, which is to tax them on, or to assess their value on, based on their market values. And I'll end with some conclusions. All right, so a little bit about the context. New York City, like many other cities, assesses most of its properties, which are 1 to 3 family homes, based on how much they're worth on the market. But for commercial buildings, it uses an income-driven approach, and that's for 2 reasons. One is that commercial buildings are not housing, they're means to generate income, and therefore it makes sense to tax them on that basis. And secondly, which is more of a limitation, is that commercial buildings do not change hands that frequently or as frequently as residential ones. So it has been argued that the sample size for the commercial sales in the city is not large enough to allow for transactional pricing or assessing their values based on their market sales. Therefore, the city's Department of Finance uses that equation to calculate commercial property values and then tax them on that basis, which is by dividing their income over their capitalization rate. So income and expenses is something that property owners have to report on every year, and Department of Finance does its own adjustments to that. Capitalization rate is a measure of the building's profitability, and the Department of Finance has internal procedures to calculate that and assign them to groups of commercial buildings based on what type of building, where they're located, and what is their income range. Now, there are some questions about this approach to capitalization rate, or more broadly to the income-driven approach, which is kind of the hook for this paper. One is that the capitalization rates, as they are calculated and assigned by the Department of Finance, cannot be perfectly accurate because, as I said, they're not specific to individual buildings, but rather assigned to groups of buildings. So that's one source of potential inaccuracy. And then the other thing, which again is another limitation that a city faces, is that the state law wants the city to assess commercial buildings as they are, which kind of prohibits the city from taking into account any, market dynamics or future events like appreciation or depreciation of value when they're calculating capitalization rates. And that is exactly what buyers and sellers on the market are able to do or are doing when they are making transactions. So part of the paper is embedded in the literature about how market prices are a better reflection of income generating potentials for these buildings. So the questions that I'll be answering in this paper, I've answered in this paper, are twofold. One is that whether we see equitable outcomes as a result of the current income-driven assessment method. And I'll look at two conventional components of equitability, which are horizontal and vertical equity. And in the second part, I will ask whether or not we are able to use a different methodology, which is assessing property values based on market sales. And I just wanted to clarify at the outset that second part of the research, that second research question is not a comparative framework to, I won't be able to say, the paper doesn't get into comparing the outcomes between the current methodology and the alternative one. It's just a feasibility analysis to show whether or not we are able to take on that approach. Quickly about the data, I had access to the universe of commercial property sales between 2010 and 2019. I have limited the sample to only certain property types that were most relevant to the study. And I ended up with a panel of about 11,000 observations over the course of 10 years. And the charts show the distribution across property types and different boroughs, but I'm gonna skip through this for the sake of showing more important things. All right, so this is back to that first research question about equity. Horizontal equity is something that is achieved when comparable properties with comparable values pay comparable taxes. Obviously, in reality, properties are heterogeneous. They don't have comparable values. So in order to make them comparable, one of the measures that is being used is the effective tax rate, which is the tax normalized by property value. So when thinking about properties with similar values, as per the city's current methodology, two similar properties shouldn't it shouldn't matter where they're located or what kind of business activity is happening in them with regard to how much tax they're paying. As long as they have comparable values, their tax should roughly be comparable as well, which is not what I found in the analysis of the panel data that I just mentioned. So the charts on the left and right show the average effective tax rate by borough and by building type. And as you can see, there is variation. So for example, on the left side, Manhattan has a higher effective, the average commercial property in Manhattan has a higher effective tax rate compared to those in Brooklyn or the Bronx, the same for retail properties compared to, for example, offices. So that's one piece of evidence with regard to inequity as a result of the current regime. Now, vertically speaking about equity, that's the question of regressivity, right? So the question is basically, are higher value properties also assessed higher relative to the lower value ones, right? In the paper, I have used a couple measures that are being used in the literature to, estimate regressivity. The one that I'm showing here today is the price-related differential, or PRD. And I decided not to show, a lot of detail or definitions about these. Just very briefly, the PRD is a measure of uniformity between the low value and high value properties in terms of how much they differ in their assessed values. And for any given sample of properties, we can calculate a PRD score. And that's what I did for my sample. According to the industry standards, any PRD score that goes above 1.1 is an indication of regressivity. Now, what the chart shows on the bottom is that even after dropping the top 10% most expensive sales, we still see the PRD score being consistently above 1.1, regardless of what property type we're looking at, which is another piece of evidence for inequities. So I wanted to wrap up here that first research question about the equitability of the current regime, which I found some evidence for inequities. Now, the second question asks, okay, now that we know about some of these issues about inaccuracy or inequity, is it possible to assess commercial buildings differently? So the first obstacle to overcome is that sample size that I mentioned. I wanted to see if my panel of 11,000 observations over the course of 10 years is large enough to allow for meaningful, sales-based assessment of property values. And secondly, is that model predicting property values accurately enough or close enough to the actual sales on the market? This is the model, the simple hedonic model that I specified for this study. It regresses property value on a number of building characteristics and location characteristics. And I also threw in some dummy variables to isolate the effects of location, property type, and time. This is what I call my baseline model. What it does is that, so for each individual observation in my data, I have an actual sale price on the market. What the model generates is a predicted sale price, which then I can take and compare to the market sale to see how accurately the model is performing in terms of predicting sale values. And these charts are showing those, these charts are showing those differences. The differential that I'm showing here, the percent difference, is the difference between the model predicted price and the sale price observed on the market. And so, for example, on the left side, that red bar at the bottom that says 8%, that means that the model over predicts the commercial property values in Manhattan by 8%. And similarly, on the right side, an over prediction of about 4.2% for office properties. And interestingly, this is where I really wanted the model to perform better, because these are where the more important properties are, office buildings and those in Manhattan. So, but unfortunately, the baseline model had its weaknesses in that particular area, which led me to try out some different iterations of the model, so making some tweaks to the model to improve these results. And here I'm showing those iterations. So I started off with that baseline model, then I focused on Manhattan and Manhattan offices. First, because that was where the weakness of the model was at, but also because I had access to the Department of Finance data called the office market areas. And these are boundaries that the Department of Finance draws around office buildings to capture the office properties with most similarities. And we only had that for Manhattan. So in that preferred iteration of the model, which is the one at the bottom, I limited the sample to Manhattan offices using those fixed effects, the office area fixed effects, but I also stratified the sample by sale price. And I did that because there's a lot of super expensive office buildings in New York City that could skew the results. So I divided the sample into 3 parts based on sale value, and wanted to see how each subsample performs. So I repeated the model for each of these subsamples. The bars are showing the differentials again generated by the model. And you can see that for the bottom and the top thirds of the sale value distribution in the sample, I still get an over prediction, but just about 3%. And I have an under prediction by about 2% for the middle part of the sample. And this is kind of good news because, these differentials are smaller than what I was getting at the baseline, the 8% or the 4.2%. This is some improvement to those, which is a segue to my takeaways, and I'm going to wrap up after this. So after showing that, there are some inaccuracies or inequities going on as outcomes of the current regime, the modeling exercise shows that if we focus on a particular area and property type and use techniques such as stratification or fixed effects, we can get reasonably close to estimating property sale values using the panel that I used. Some of the upsides of employing this alternative methodology is that first, we don't need to. The Department of Finance has, as far as I know, many complicated internal processes to deal with capitalization rates and income and expense data and things of that sort. So this using this method could save some time and effort on that regard. One thing about economic shocks, such as what happened at the COVID time last year, is that transactional pricing is one way to mitigate sudden shocks to local government revenues from property taxes. Because what happened last year was that many commercial buildings suddenly lost a lot of rent income because businesses closed down, and that immediately and visibly affected the city's revenue from these buildings. Whereas, buyers and sellers usually, hopefully, don't see the pandemic as a permanent thing. So they are able to, smooth out the shock effect. Obviously, the transaction prices would decline at the time of any kind of shock, but hopefully not as sharply as what we saw last year. And lastly, I wanted to, again, reiterate that the paper does not get into analyzing the outcomes of the alternative sales-driven methodology that I just discussed. So I only established its feasibility, and I won't be able, within the frame of this paper, won't be able to say anything about which alternative is more, or which methodology is more preferable with regard to equity or things of that nature. All right, I'm going to end here. Here's my contact, and I'm happy to try to answer any questions. Thank you.
Well, thank you very much to our 3 presentations. I think they were excellent and brought forward interesting new ways of doing things. I'd like to encourage our attendees to submit some questions through the Q&A, and I think I'm going to kick it off with a question. Three of you presented a new way of thinking about either governance or finance that school districts, local governments, or tax departments could really think about reshaping how they do business and how they conduct themselves. What do you see as being significant barriers to adoption to this new way of thinking or to this new approach? Have you seen any jurisdictions perhaps implementing what you're suggesting and rethinking? Kevin, can I kick you off with that?
Yeah, one of the larger counties in New York State, I'm not going to identify the counties at this point, but it's a real large county. Their response to the strategic planning was that, well, the previous administration had a strategic planning system, and then a new administration came in and they didn't follow through on it, and we're thinking of having it again. So there's no real incentive here to have strategic planning. That's why I'd like to have New York State implement a law that they have to have strategic planning, just like they did for New York State agencies. So if you look at something like the New York State Health Department, they have close to a $90 billion, it's close to a $90 billion budget. They have to have a strategic plan. A lot of the money goes to counties to spend, but the counties don't have to have a strategic plan. So it just isn't logical that large New York State agencies have to have a strategic plan, and larger local governments don't. So we have to get this effort moving. I mean, strategic planning isn't a new idea. Those John Bryson books I have listed there go back a long, long time. So there's a kind of a political barrier against strategic planning being implemented, I think.
Robert and Minch, have you seen school districts or local governments implement the changes you're considering, or do you see overwhelming barrier? Do they see it as a barrier?
I think that everybody is struggling with this issue. I mean, the numbers are so huge in terms of the unfunded liabilities, but I think we're just at the start of this process. Went through this with the pension liabilities, and pension liabilities are generally better controlled now than they were. And I expect that some of the research that we're doing, I hope, is going to lead to more definitive policies. But I think districts now are just up in the air due to the complexity of and the huge swings in the liabilities. We're looking at this over a period of time. I mean, there are hundreds of millions of dollars of adjustments that are being made. So I think GASB needs to tighten the standards, and the actuaries need to come up with a stronger set of standards that are applied uniformly. Because one thing we found is that they're not really uniformly applied. So we need to improve that, I think, in order to get more school districts to look seriously at this.
And Pooya, what are some of the challenges for developing and implementing new commercial property tax structures?
Yeah, I would say one is that, New York City is, part of New York State. So part of what we're dealing in property tax world is the state law. For example, one example was what I gave in the presentation about not being able to, so the state wants the city to assess buildings as they are, just to avoid, speculation or things of that nature. And that, creates some inaccuracies that are not favorable. So a part of it is having to deal with that kind of higher, hierarchy of making the law. And then the other thing that I could think of is New York City being New York City. It is not like many other local governments. It has, the number of properties, the value of the properties here in the city creates a lot of, I would say, logistical unusual or anomalies that have to be dealt with as a specific case, as a special case. So yeah, I think that those are the main, I would say, barriers.
Great. So we have a question for Robert and Minch from one of the attendees, and they point out that there's an alignment problem here. The decision makers about these costs and retirement benefits, health benefits, they are not the same people who are paying the bill for it. The teachers' unions are likely negotiating these benefits, but aren't necessarily facing these costs. So how do you reconcile this? Do you see challenges in potentially reconciling this and beginning to unwind some of those challenges in this problem?
Well, I mean, I think that's right, and that's that's part of the traditional case for forward funding pension benefits or any retiree benefits. And so far, it's a form of compensation, right? It's buying goods and services in the current period, but charging people, in future periods for it. I think those issues are a bit trickier than that. I do think decision makers, at least at times, or at least potentially, think of who they're making decisions for a little bit more broadly than just current taxpayers. And it's not clear who also is getting the benefits of this educational services that are provided. Future taxpayers get some of those benefits as well from educating current populations. So I do think that the question about alignment is a little bit trickier, and questions about intergenerational equity are a bit more complex than that.
Great. And then I think also we had someone ask the question, is there perhaps a hybrid solution? Is it about cutting costs and possibly pre-funding, perhaps using a bond to mitigate some of these tax burdens to forward fund needs?
Well, I mean, one way to amortize, I guess, would be, I don't know about the bond option, but one of the districts that we have looked at has really reduced their future liabilities quite dramatically, and through renegotiation of what healthcare benefits will be provided and who they'll be provided by, and that to me raises some questions about treating these as liabilities. They're not necessarily liabilities in the same way as debt, because there's lots of uncertainty about what these future costs are going to be, which raises further questions about forward funding. But as in most cases, right, I do think the optimal solution is going to depend on the district and will likely involve a mix of forward funding with thinking about benefit structures moving forward. And maybe in some cases, like those districts where we saw very high burdens, right, they may need some outside help. And that's one of the things we're trying to clarify. Are there a set of districts where perhaps outside help could be justified?
Yeah, I sort of think as we get more clarity on the obligations and the real, really handle on assessing what those obligations are going to be, I think there'll be an opportunity for more change. I mean, in New York State, there isn't an opportunity to forward fund the OPEB liabilities according to state law at this point. So that would take legislation, but I think discussion will come out as a result of more research and more analysis over a period of time. California is doing a lot of work in this area too.
Excellent. I think this is a great opportunity to kind of transition over to lunch. First of all, this webinar or in session will be available on the Rockefeller website. But I thought, since all of you are in a somewhat preliminary stage with this work, I think our audience would be curious to know where to follow you and see where future developments are going to be published so that they can follow up on the work you presented today. Kevin?
My last slide has an email. You can send in any questions about it, how it proceeds. Instantly, it's probably going to take another month before I get all the large counties to answer the question. And I analyze it as it comes in. So it won't be that long before that part of the study will be finished. Then I have to do it for cities and large towns. And a FOIL request analysis like this usually takes about 3 months to finish, because people stall answering the questions and you have to analyze it. So by the end of this year, I would have everything finished. I hope to present it here next year, though, the final copy of it.
And Robert and Minch, as you continue your work, where do you anticipate, where could our participants follow you?
Yeah, so, this is actually, you're correct. This is at pretty early stages for us. We don't have a paper written or reports written or dissemination plans worked out. We'll probably develop a working paper and post it somewhere on the Maxwell site at some point.
Great. And Pooya, when will we perhaps see your study with a little more detail? It was fascinating.
Yeah, this is going to be an IBO publication, hopefully soon, next couple months. So you can probably see it there when it's published, but I'm also happy to discuss it further offline. If you look me up at on IBO's website, you'll see my contact there, and I'm happy to chat about it.
Well, thank you again for everyone for our panelists and participating and presenting your work. The Local Government Lab is now going to take a little bit of a break and allow everyone to stretch their legs and get something to eat. And we hope to see you again at 12:30 for panel number 5, which is going to be serving vulnerable communities in time of crisis and need. Thank you, everyone, and enjoy your break.
Thank you.